The impact of caring for patients with coronavirus is being felt in hospitals right across the south. At the Queen Alexandra in Portsmouth, nurses say they're stretched like never before. Staff are physically and emotionally exhausted after 10 months on the front line, and the real impact may not be felt for many months. Our health correspondent Alistair Fee and cameraman Ian DaCosta were given rare access to the intensive care unit at the invitation of the hospital, keen to show the reality of caring for the rising number of patients with COVID-19.
You have to keep going. For our patients, for the public, for ourselves, for our colleagues, we just have to keep going every single day.
My worry with everyone is they are getting tired, both mentally exhausted and physically exhausted.
Ready, steady and roll.
Overworked, taking on extra shifts and caring for many more people. The strain is really beginning to show.
It's exhausting, absolutely exhausting. And we all signed up to be nurses, but none of us ever imagined we'd go through something like this in our career.
Abby has always wanted to be a nurse, but in recent weeks is no longer so sure.
We are all broken, I'd say, honestly. We all cry every day, basically. Most of us have had time off with stress. We've been going through counselling sessions. It's just broken us.
There is enormous pride here in these teams. Those running the trust are only too aware of what they continue to ask of them.
They're stretched, they're tired. In many cases, they're drained and emotional. We're doing everything we can do to look after staff, and we are incredibly grateful for just how hard they're working.
Kirsty has worked in intensive care for 10 years, but told me the toughest moment came in recent weeks.
Holding the hand of someone who died on their own. All their family had COVID, so they couldn't come in to see them. And so he had to die on his own with us nurses holding his hand. That was really hard. And that was right before Christmas.
Staff here are witnessing the very worst of this virus. They're caring for twice as many patients as they were back in the peak last April. The number of beds here have tripled recently because the patients they're seeing are rising further still.
When COVID does go away, and it will, we will all have better times to look forward to. I worry that our staff and other staff around the country are going to be affected by this in the much longer term, and that's a worry.
Denise is one of twins. Together with her sister, they've both worked at the QA for 37 years.
There are patients now in recovery where I work in theatres. There's more today than last week, and so obviously it's going to be worse than March, April. I don't know. I'm hoping we can cope with our staffing. The worrying is the staffing, and obviously our 2 beds, but our staffing is tight.
Some procedures take several doctors and nurses. This patient is being turned onto the stomach to help get oxygen to the lungs. It can take up to 10 minutes to complete.
I think what will hit me and others more is when we're over it and everything sort of feels like it's all getting back to normal. That's when it's going to hit. But like many others, you know, the reality is, am I sleeping well? No. Am I worrying about it all the time? Yes. Am I coping? Yes, reasonably, but it's difficult.
To make an already difficult situation worse, hundreds of staff are themselves off sick, many with COVID-19.
I wouldn't say we're losing the battle. What I would say is that I think we haven't got control. I am actually, surprisingly perhaps, optimistic about our ability to manage the situation in this hospital. I genuinely believe we have got a phenomenal group of staff across all the different disciplines who will go to whatever limits necessary to look after patients. We need the support of everyone in minimising the new cases by avoiding contacts.
At the last official count, 420 beds were full of COVID patients. It's now inevitable that in the coming weeks, many more than half of the 1,000 beds here will be used in the fight against the virus.
I just keep thinking if we can just get through this next section, then maybe it'll start easing off soon and then I can cope more. But yeah, I wouldn't say I'm coping at the moment. It's hard.
In the coming days, the workload for these teams is going to get greater still. Alistair Fee, BBC South Today.
Real pressure on NHS staff in all our hospitals.